Hi, I'm Emma. I'm a cancer biologist in the Auckland Cancer Society Research Centre. I grew up here in Auckland, but I've spent the last 11 years in research institutes overseas. But about a year ago, I decided to return home to New Zealand and sort of bring the skills and expertise I learnt overseas back home with me, and I've now started a new breast cancer research lab here in the Auckland Cancer Society Research Centre. So to study cancer in the lab, we ideally need to use models which really represent how a tumour would grow in the human body. So having a model that will represent how complex tumours are and also that variability between patients. So in my research lab, I'm trying to use material which has been donated by breast cancer patients in New Zealand and actually use those cells and that tissue that's been donated to study cancer cells in the lab. So one of the techniques that is currently used a lot is commercial cell lines. So these are cells which are brought from overseas, which are grown in 2 dimensions on layers. And that is often how a lot of research is done. So there's a lot of drug testing that's done in these 2-dimensional flat layers of cancer cells. But that's not a very good representation of what a tumour would actually be like in a patient, which is a 3-dimensional structure. And also using cells that have come from a commercial company are not as good, obviously, as using cells which have come from a breast cancer patient in New Zealand. So I'm trying to solve both those problems. So by taking tissue which has been donated by a New Zealand woman with breast cancer, and I'm trying to grow the cancer cells in this 3-dimensional structure. And this will much better represent how they will actually grow within patients. This means that if we find a discovery or we have identified a new drug that can be used to treat breast cancer, that this is actually being tested in tissue from New Zealand patients, which means it's more likely to hopefully go into the clinic and become a new cancer therapy. So what you can see here on the screen, these are what we call organoids. So these are essentially mini tumours, and these are being derived directly from a New Zealand breast cancer patient. So you can see that there's a lot of variability in their sizes, but in general they have that 3-dimensional circular structure. And so each one of these small organoids we can use for experiments, and we can, for example, put drugs into this assay, for example a chemotherapy agent, and we can see how that drug will affect these mini tumours in as well. And so we can grow these organoids from lots of different patients in New Zealand, and we can really capture that spectrum of different types of breast cancer. So hormone receptor positive, triple negative breast cancer, or triple negative, and we can grow organoids from each individual patient, and we can use them to understand what is the cancer biology, so how are these cancer cells growing, what's making them grow, what's helping them to grow, how are they surviving, and how are they responding to different drugs, and how does this change between patients. So all these tiny these balls of cells that you can see in here, these are what we call organoids. So they're essentially mini tumours in a dish. My specific focus is on breast cancer research, and breast cancer is really one of those cancers which touches everybody. 1 in 8 women in New Zealand will be diagnosed during their lifetime, and so it's one of those cancers that even if you don't have necessarily in your immediate family a patient with breast cancer, and certainly within your friends and your wider family, that for me, just research, I feel like it can have such a huge impact because the number of cancer patients that a discovery can help. One discovery in the lab can change the outcomes for thousands of patients. I would say that your support can really make a huge difference. It can allow researchers to stay in New Zealand to conduct their really exciting and amazing research that hopefully will have a significant impact on cancer patients in New Zealand. So it's a huge support, and it allows us to do the research that we love. It allows us to stay in science and to continue working to hopefully finding a cure for cancers in New Zealand.